cardiovascular system. Congestive cardiac failure. Multisystem derangement that occurs when the heart can't eject blood delivered to it. Left heart. Systemic HTM. Mitral/aortic valve disease. Ischemic HD. Right heart. Left ventricular failure. Intrinsic lung parenchyma disease. Entire heart. Congestive cardiac failure CONT'D. Adaptive changes. Neurohormonal. Adactivity of the sympathetic nervous system. More forceful contraction ampersand in hour. Molecular. Morphologic. Hypertrophy and dilatation. Initially positive. Oxygen demand. Vulnerability to ischemia. Congestive cardiac failure CONT'D. Dilatation/chamber enlargement. Dilated chamber is meeting the needs of the body equals compensated HF. Decompensated HF. Clinical feature. Dyspnea. Exertional. Earthapnea. Paroxysmal nocturnal dyspnea. Severe sob, coughing, choking sensation and wheezing. Congestive cardiac failure CONT'D. Clinical features CONT'D. Fatigue. Third heart sound. Atrial fibrillation. Cyanosis. Acidosis. Atheroscleorsis (ATH), characterized by atheromas, atheromatous, or fibroflatty plaques that obstruct the vascular lamina. Intimal thickening. Lipid accumulation. Primarily affects elastic arteries. Aorta. Carotid. Iliac. Atheroscleorsis (ATH) CONT'D. Risk factors. Age. Men affected greater than women. Women protected by estrogen. Diet/lifestyle. Hyperlipidemia. Familial predisposition. Deutschmark, HTN, deranged lipoprotein metabolism, hypercholesterolemia. Atheroscleorsis (ATH) CONT'D. Cigarette smoking. Deutschmark induces hypercholesterolemia. Homocystinuria. Inborn error of metabolism, premature vascular disease. Hyperhomocystianemia. Low folate, B6 and B12 intake. Type of personality. Uncontrolled weight gain. Atheroscleorsis (ATH) CONT'D. Pathogenesis. Chronic endothelial injury. Ed permeability, leukocyte adhesion, greater than thrombotic potential. Insudation of lipoproteins. Oxidation and free radical generation. Adhesion of monocytes. Transformation into macrophages and foam cells. Smooth muscle cell proliferation. Ischemic heart disease. Syndromes characterized by imbalance between myocardial oxygen demand and blood supply. Commonest cause is narrowing of the lamina of the coronary arteries. Coronary heart/coronary artery disease. Ischemic heart disease CONT'D. Syndromes. Angina pectoris. Acute myocardial infarction (MI). Sudden cardiac death. Chronic ischemic HD with CCF. All are late manifestations of coronary atherosclerosis. Acute coronary syndrome. Unstable angina. Acute mild sudden cardiac death.